So what kind of tests do we have? Diagnostic studies do we have to see if, if we suspect that someone's liver is diseased, or if they have hepatitis, or if the liver is the cause of what's making them sick? Well, we have liver function tests, and so AST, ALT, alkaline phosphatase, and GGT. So AST stands for aspartate aminotransferase, and ALT, you don't need to memorize this, stands for alanine aminotransferase. And they're really two enzymes, you don't need to know the function, that are made in hepatocytes. So when the liver is injured and the hepatocytes, some of them die, they release AST and ALT, and of course bilirubin, into the bloodstream. And we detect the AST, ALT, and elevated bilirubin in the bloodstream. So alkaline phosphatase and GGT tend to be made and produced more in the bile ducts, the little tiny ones in the liver, and the larger bile ducts that you saw in the anatomy picture, like the hepatic bile ducts and the common bile duct. So if they're elevated, they're usually an indication that something is blocked in the biliary system. Okay. Serum and urine albumin, we've already spoken about. That's elevation of bilirubin in the bloodstream because the liver is not processing the heme, or is just not making bile, so it all backs up into the bloodstream. We can do viral studies if we suspect a viral infection for hepatitis A, hepatitis B, or hepatitis C. We can do serum albumin levels to see if albumin is at a proper level, and if it's not, that's a strong indication that the liver is not functioning properly because it's not maintaining proper albumin levels. We can do bleeding times, prothrombin time, or INR, to see if there's a decreased clotting ability, abnormal clotting, because we're very dependent on the liver to provide those clotting enzymes. We can do antibody tests if we suspect autoimmune hepatitis. That's getting a bit more advanced, but those are available. And finally, we can take a liver biopsy. So we'll put a needle through the ribs into the liver and take a core biopsy and analyze it to see exactly what's going on with the hepatocytes of the liver. Okay, color of poop slide. This is I think this is actually a very informative slide. It may be hard to see, but basically what we're trying to get at here is in liver disease, you really get that tea-colored urine, the brown urine, dark, from bilirubin in the bloodstream that's flowing into the urine. And you get the clay-colored stool because the bilirubin isn't being secreted into the small intestine as much. So the stools, which are dependent on bilirubin for their color, become much paler and beige in color. And again, looking at the urine can tell you so many things, so much information about what's going on in the bloodstream. So I won't go through all this, but if we look at the brown, increased bilirubin, which is the pigment of red blood cell breakdown, and it even gives you a bit of information. So pre-liver conditions, hemolytic disease. Liver conditions is all the conditions that stop the liver from processing the bilirubin. And then of course post-hepatic obstruction, which we spoke about, which can be from a blocked bile duct, from a cancer, or from a gallstone. So that for the tea-colored or brown, really think about those three processes: pre-liver, liver, and post-liver. Okay, so on to viral hepatitis. So by far there's three common viral hepatitises or hepatitis. We're also going to talk about uh, other ones, but they're usually just hang-on viruses. They're not causing injury directly by themselves. So by far it's hepatitis A, B, or C. And these viruses are transmitted in different ways that we'll get to. They cause different amounts of damage, and some are self-resolving, and some become chronic, and then of course lead to all those chronic problems, such as chronic hepatitis, cirrhosis, and all of those symptoms that we spent 15 minutes on a previous slide. Okay, so these cause direct hepatocyte injury. Okay, they destroy the hepatocytes, the liver cells. So initially, what do you have when your liver starts to be affected? Loss of appetite, jaundice, from the hepatocytes being destroyed and the bilirubin backing up into the blood. Nausea and vomiting, a very non-specific symptom. Fevers, well, it's a viral infection, so fevers can go along with it. Weakness, yeah, one of your major organs is infected. Right upper quadrant discomfort, that's where the liver lives. Arthralgia, which is joint discomfort, but it's not arthritis, which is inflammation or damage to a joint. So arthralgia is achy joints, but not swollen joints. Dark urine, that's from the bilirubin flowing into the urine, making it dark. And clay-colored stool, as we've mentioned before.
Okay, so let's do a question together. What is the pathological process of clay-colored stools in patients with liver disease? So the liver is involved in bile production, and it secretes bile down the hepatic ducts. It can store it in the gallbladder, and finally it will send the bile down the common bile duct that will attach to the pancreatic duct, and finally it'll be secreted into the duodenum. Okay, so what gives our stools its normal color is bilirubin. Okay, so bile has bilirubin within it. So anything that impedes bile from getting to the intestines will alter the color of stool, and typically to a pale color. Okay, because bile is giving it that brown color. Okay, so let's look at the answers here. Damaged Kupffer cells. Well, Kupffer cells are really just macrophages that are within the liver that are part of the immune system. So that won't be it. Increased serum bilirubin. So increased serum bilirubin will make you jaundiced, right? It'll give you that yellow color of your skin, the yellow color of your eyes, but it won't cause clay-colored stools. Lack of albumin. Yep, if you have liver disease, you will have lack of albumin, which is going to affect your oncotic pressure, and you're going to become edematous. Okay, so low albumin typically leads to swollen legs and edema throughout the body. Lack of GI tract bilirubin. So there it is. Okay, so whether it's liver disease that's not producing proper bile, or there's an issue with the bile getting to the gastrointestinal tract, such as a blockage in the bile ducts, a blockage in the common bile duct, something that's impeding the bile from getting to the GI tract, that will lead to clay-colored stools.
So hepatitis A is really, and by the way, we're immunized to most of these, to hepatitis A and hepatitis B. But hepatitis A is typically acquired the fecal oral route. So it's usually from contacting someone with hepatitis A, or contaminated food because someone with hepatitis A prepared it for you, drinking dirty water. So it's not very common in North America as much, or at least in the United States and in Canada. But traveling to developing countries, you're at risk for hepatitis A because of the food, because of the water, the poor hygiene. You're at significantly less risk of getting hepatitis A from sex or IV drugs. Why? Well, there's no chronic carrier state. You don't become a chronic carrier of hepatitis A. So you can only get it through sex or IV drugs is if the person that you're having sex with or that you're sharing a needle with has active hepatitis A, which typically lasts only weeks to months. So it's usually from food and from contaminated food and water, and rarely from sex or IV drugs, but possible. You're infectious typically 2 weeks before even getting the symptoms, which means that you can pass this on through preparing food, this is the time when it's through sexual activity, IV drug use, close contacts while you're infectious. There's really no treatment for this hepatitis. It gives you all the symptoms of an acute hepatitis. You often you become jaundiced with it, nausea, vomiting, anorexia, weakness, clay-colored stools, low-grade fevers. You really feel quite terrible, and then it's self-resolving. It goes away by itself. We do use immune globulin, say if we know someone has hepatitis A and there's people around them that have never been vaccinated to hepatitis A, we can actually give them passive immunity with hepatitis A immunoglobulin. It's just temporary, but it'll protect them from actually getting the virus. Most people in the United States have been vaccinated since it's part of your childhood vaccinations. And remember, it's not a chronic disease. It does not lead to chronic hepatitis or cirrhosis. Okay, so let's just quickly go around this. So transmission of hepatitis A, causes of hepatitis A. Failure to comply with the rules of personal hygiene. Okay, that's a good one. So not well, usually it's consumption of contaminated food and water, so that's an interesting one. Use of non-sterile syringes. So if you're sharing syringes with someone who has active hepatitis A, but because it's not a chronic hepatitis, it doesn't last for years, so you're not going to continually transmit it to people through sharing of syringes. Use of contaminated water, definitely. Household contact with sick person, definitely. Swimming in dirty waters, absolutely, because invariably you drink some. Staying in a large crowd of people could be a risk factor. Yeah, especially in developing countries, because someone might have hepatitis A. Sexual contact with a sick person. So they have to have active hepatitis A in order for you to acquire it. So hepatitis A, think dirty water, poor sanitation, and dirty food, usually. Hepatitis B. Well, hepatitis B, most common way to acquire it is sharing of blood or body fluids. You can also get it through sexual activity, because that can be sharing, well, obviously that's sharing of body fluids. Delivery, so a mother who's hepatitis B positive has a very high chance of transferring hepatitis B to the newborn. Deep needle stick injuries at a hospital can cause hepatitis B, and IV drugs. Okay, so sharing of blood or body fluids. You don't get it from coughing or sneezing. And saliva is included in body fluids. There's been very, very few transmissions through saliva. I think if you were asked directly, can saliva transmit hepatitis B? It is possible. So I guess I would say yes, it's a body fluid, but it's very rare. Perinatal, 90% mother to infant transmission. So that's a very high number for infants being infected by their mother. Hepatitis B typically lasts 4 to 6 months. Of all those hepatitis symptoms, you're jaundiced, you're sick, you're weak, you're anorexic, you got fevers, you're not eating well, you're not drinking well, all the other symptoms as well. And then most people clear the virus, and a small percentage go on to have chronic hepatitis B, about 5%, so 1 in 20. Okay, so it's a much smaller percentage than an infant getting hepatitis B from their mother. Most infants are vaccinated, so you have childhood vaccinations to prevent hepatitis B later in life. There are some treatments for hepatitis B, alpha interferon. There's some antiviral drugs that are used to slow it down, to extend people's lives with chronic hepatitis B, but there's no cure. Okay, so chronic hep B, there's treatments but no cure. Okay, so just here, a bit of a repetitious slide here. Acute symptoms of viral hepatitis, most of them resolve in 4 to 6 months. Okay, so the liver recovers and you go back to your normal functioning liver. 5% lead to chronic hepatitis, so that's chronic inflammation, chronic malaise and weakness and weight loss and arthralgias, chronic elevation of liver enzymes because there's inflammation. So AST, ALT, bilirubin will be increased. And if this goes on for decades, which it often does, it finally leads to fibrosis and scarring called cirrhosis. And as I said, there's no cure for hepatitis B yet. There's only treatments. So what are the complications if you have chronic, if you have hepatitis B? So you're sharing a needle, you're diagnosed with hepatitis B. The complications are, well, you have a 1 in 20 chance of becoming of developing chronic hepatitis, which decades later can lead to cirrhosis. And with chronic inflammation and cirrhosis, you're at risk for developing a hepatocellular carcinoma, a liver cancer. Or right at the beginning, when you get hepatitis B, you could have a very severe case of hepatitis B and have fulminant hepatic failure, which was on that slide. I think it was in that salmon color on one of the upper slides where we spent 15 minutes. Fulminant hepatic failure right from the beginning in the first couple of months. That's very unusual, but it can happen in hepatitis B. So usually, so most people will clear it in 4 to 6 months. 1 in 20 will go on to have chronic hepatitis, which will then lead to cirrhosis and all its symptoms and signs that will repeat again. And then hepatocellular carcinoma is a risk factor, which is a very serious cancer.
Okay, so let's do another question together. What is a common cause of hepatitis B? So really this question is asking you, how are you going to contract hepatitis B? How is it transmitted? So if we think of the different common types of hepatitis, we have Hep A, Hep B, and Hep C. Hep A is the one that is typically transmitted fecal oral, meaning contaminated food, contaminated water, a contaminated person, right? So it doesn't need blood transfer. Okay, it can infect someone through the oral route. Okay, hepatitis B typically needs blood-to-blood transfer. Okay, and so does hepatitis C. So hepatitis B can be acquired through a blood transfusion, very rare now since the screening of blood is fantastic. It can be spread through the sharing of needles. It can be spread through sexual activity. Okay, anywhere where there's potential for blood-to-blood sharing. Hepatitis C, again, can be shared through intravenous needles. It can be spread also by a blood transfusion. It can be spread through sexual activity. It's much more difficult to acquire hepatitis C through sexual activity compared to hepatitis B. Okay, so and the other way, of course, of obtaining hepatitis B is through a deep needle stick injury. Okay, so how do we get hepatitis B in this question? So A, skin contact with an infected person. No, not possible, right? Unless there was open blood on the patient's skin and there was open blood on the person that's touching them. It's not possible. Eating contaminated food, no, that would be hepatitis A. Sexual intercourse with an infected person, definitely. Okay, so there's potential for blood-to-blood transfer there, and you can acquire hepatitis B. And that's partly why hepatitis B shots are given early on in childhood, okay, to vaccinate people before any sexual activity, before any intravenous drug use, anything like that. They've been immunized to hepatitis B. Okay. Remember, about 5% of people with hepatitis B go on to develop chronic hepatitis, where it stays with them for life. And about 60 to 70% of people with hepatitis C will go on to develop chronic hepatitis. So very high. Compared with hepatitis A, which is a self-resolving hepatitis. You don't develop a carrier state. Okay. Last answer, inhaling infected droplets. No, that's not a way of getting hepatitis B. Okay, there's no blood-to-blood transfer there, so that one's not possible.
That will mean that a large majority of people with Hep C will have chronic hepatitis leading down the road decades to cirrhosis, liver failure, and death. So it is a very positive thing that there is a cure for certain strains of hepatitis C. Hepatitis D, E, or G, they're just kind of hang-on viruses. So hepatitis D needs hepatitis B in the patient. So it just makes the hepatitis B more aggressive by having hepatitis D. I wouldn't get as excited or look into these as much. Hepatitis E, not very common in developed countries at all. Most hospitals would not test for hepatitis E or D or G. And hepatitis G, can exist with B or C and HIV. Again, it's not a virus that infects by itself. Okay, so let's look at the causes of hepatitis C, and they're mainly going to surround infected needles and IV drugs. So the first one is improper sterilization in dental clinics, tattoo parlors. Sure. Use of non-sterile needles for injection, IV drugs. Sexual contact would be high-risk sexual behavior, typically not monogamous married couples that you transmit Hep C through regular sexual activity. During childbirth is possible. Complications of an infectious or bacterial disease, for example, a complication of syphilis. So whenever you have one sexually transmitted disease, you're at risk for getting others. And why is that? Well, typically if you're sharing needles, you're not just going to get hepatitis C, you might get HIV along with it, or you might, so because sexually transmitted and intravenously transmitted diseases group together, you can often get more than one disease. During pregnancy, mother to fetus. During operation, so that would have to do with needles and sterility of tools. With donor blood transfusion. Well, if you receive a transfusion of, you could get hepatitis B or C, but they're so heavily screened. The blood that we transfuse to patients, it's extremely rare. It would likely be 1 in 10 or 20,000. It would be a very, very rare, probably higher than that actually, that you'll acquire hepatitis B or C. And here's a comparison of the, by far the most common 3 hepatitis, viral hepatitises. So Hep A, fecal oral, incubation period 2 to 7 weeks, no chronic infection. Yes, there's a vaccine. No active treatment. It's just supportive treatment. So have a look at this this slide. You'll see Hep C is more blood to blood. We spoke about syringes, dirty needles, sharing of IV drugs. Hep B, sure, sexual contact, blood to blood, fluid to fluid, body fluids, and mother to child.